The teams are all set to square off in this weekend's Super Bowl, but for several doctors, their battle began before the NFL season kicked off. ABC News medical contributor Dr. Christopher Magovern takes a closer look at the hard work being done to combat head trauma on the NFL gridiron.
Let's ride.
That's a big hit.
Violence in the form of bone-crushing hits and rattling collisions is woven into the very fabric of professional football. The challenge for the NFL has been how to maintain the inherent physicality of the sport while also protecting its players. Enter the men entrusted in maintaining this balance, co-chairs of the league's head, neck, and spine committee, Drs. Richard Ellenbogen and Hunt Batcher.
It's a fabulous, fast sport played by enormous, powerful, fast athletes that are bigger and faster than their predecessors. That's an inherently unstable environment.
Their task comes at a time in which we are gaining unparalleled understanding of brain trauma, as concussion has become a buzzword in the world of sports.
Concussions certainly are nothing new, but we seem to be hearing so much more about them. Is that because we're beginning to understand a little bit more about them? Is it because we have more knowledge of them? Is it just media hype, or are we really in an epidemic where there are more concussions?
I don't think there are more concussions. I think what we're seeing is a perfect storm of events where we understand more about concussions. Now, if you have a concussion, it doesn't mean you're knocked out. 90% of all concussions occur without somebody being knocked out. And we now are pulling both kids and professionals out of games and out of practices even when we're in doubt. We're being, I would say, more conservative about our approach to concussions than we were decades ago.
Despite all these measures, many within football feel that the greatest success in preventing concussion is through better educating its players and changing the very culture of the sport itself.
I think anytime you have changes, there's a period of adapting to those changes from a player standpoint, a coaching standpoint, officiating standpoint. But I think we're getting to the point where people understand what we're looking for, and we'll hopefully get to a point where it's being enforced on a consistent basis, and the players understand what we're looking for.
I think it's crystal clear that there is a culture change occurring, and it's reflected in the data even from this year. More concussions have been reported year to date than were reported during the entire season last year. We've tried to make the argument in many different venues, in many ways, that playing through pain is part of sports. That's when you bang your knee, you bang your thigh. Those are things you play through. Injury to your brain is not something you play through. That can have lasting consequences that jeopardize the rest of your life.
In addition to a change in culture, the remarkable advances in equipment technology have many excited about the possibility of limiting the effects of head trauma.
We learned a lot in terms of what they're trying to do. They're changing the foams that are within the underlining of the helmet. Likewise, the outer shell, there are different materials being considered for this.
What about the idea, and there's a lot of discussion about this, the fact that these helmets are getting so big and so strong now that players are using them as a medieval battering ram. What are your thoughts as to whether or not maybe the helmet is the problem, and if we go away from the helmet and less padding, maybe we'd have less injuries?
Right. It's a good point. The question's been raised, should we take helmets off during practice, and that might then eliminate that as using it as a battering ram or a weapon. The challenge has been we sort of want our cake and eat it too. We want it to also prevent or manage the energy of the brain inside that cranial cavity. And some of the data that we have at UNC that shows the lighter practices where they only wear a helmet with no shoulder pads and no pads, it's called a thud practice or a shell practice, that when that's the only piece of equipment that they're wearing, that the magnitudes of those impacts tend to be slightly higher in that than during regular practices, if that's the only thing they have to use.
The NFL also knows that it has a responsibility that extends far beyond the league's playing fields, as they are the standard bearer for which much of the athletic community takes its cues, from the NCAA to youth sports.
All of those other areas we have to continue to make advances in to try to make the game safer for our players, but also every other level of football and every other sport. This is well beyond football. We've got to do this for a variety of good reasons.
This is bigger than football. This is the 30 million kids that play on the playground. For us, the exciting thing, all three of us have kids. And, you know, if we make it safer for our kids, then you know the parents out there will enlist their kids in more sports instead of less sports. So that's what's exciting for us.